Hello everybody, I'm Glen Macnow. Welcome to Ask the Doctor, presented by Cooper University Healthcare. I'm here today again and pleased to be with Dr. Brendan O'Connell, surgeon with the Cooper Metabolic and Bariatric Surgery Center. Doc, nice to see you. I hope you had a good holiday.
I did, thank you.
Pleasure, man. Okay,
so
here we go. Dr. O'Connell, a lot of questions about weight loss surgery options that we're going to get to. We've gotten a ton of good questions, which is always very encouraging, so let's get started. And here we go. Let's start with this one. Before moving toward bariatric surgery, what do you think that Weight Watchers, if somebody's going to try to, get there on their own, is Weight Watchers the best option out there?
Okay. I think that Weight Watchers is an excellent program. It incorporates a lot of the things that we try to teach our patients about getting used to reading labels, measuring what you're eating, being very aware and conscious of what you're eating, how many calories you're taking in. There are many good dietary programs. When I see a patient for weight loss surgery, one of the first things I go over with them is what kinds of diets have you tried on your own to try and lose weight. So not only is it important from a common sense standpoint, you want to try dieting and non-surgical means of weight loss first before we jump to surgery, but also from the standpoint of getting your operation covered by your insurance company, we need to document that you have tried several methods of dieting before we can get this approved.
Okay.
So it's important from that standpoint.
All right, so we have a lot of questions that are along those lines. I'm going to jump ahead a little bit because several of the questions we got concern exercise and kind of the balance between diet and exercise and losing weight. Somebody asked flat out, what's more important, diet or exercise? Is one more critical than the other?
I don't think I could possibly say that one is more important than the other. Both clearly are very important. For our patients, it is sometimes very difficult for them to exercise. They are at a certain weight. Many of them have problems with their backs, with their knees. It would not be uncommon for somebody to be sent to us from an orthopedic surgeon who needs to have a knee replaced or a hip replaced, and they need to have weight loss surgery first before they can get that done. So sometimes exercise is limited, and therefore we may put a little more focus on diet because that is something that everybody can control. But certainly any amount of exercise is helpful. We have exercise physiologists who work with our program, and they're able to tailor a regimen of exercise to what you can do. So in other words, if you can't go out and jog several miles a day, there may be exercises that you can do from your chair, in your home, things that are limited. Anything to get you moving is going to help stimulate weight
Sure,
loss.
start with what you can. All right, so we ask them as we get them, and this is, I tell you what, if you can answer this question, you'll run the world. What is the fastest way to lose massive amounts of weight?
Well, probably the fastest way to lose massive amounts of weight would be to have a weight loss operation.
Right.
That is certainly not what we recommend in terms of trying to lose the weight really quickly. The process of having weight loss surgery involves a period of time beforehand where you're getting ready for surgery, trying to lose weight with diet, and then we perform the operation. And then there is a recovery period, and after the operation, you're going to lose weight gradually as the months go on. So this is not the type of process where you're going to see results instantly overnight. You need to get into the mindset that this is going to be a long journey and that the results are going to come steadily over time as you put in the work that is going to be necessary.
Okay, so the next one is, how do I know if I am a candidate for bariatric surgery?
So that's a very common thing that people ask all the time, and fortunately there are some pretty concrete guidelines as to who qualifies for surgery. A lot of what we do is based on a number called the body mass index. So one of the first things we do is measure your body mass index. That is a measurement that we get from your height and your weight. So if that number is 40 or higher, then in general that's all you need to qualify for weight loss surgery. If you're in the range where your body mass index is between 35 and 40, then you may qualify for surgery, but in that case you need to have something else in addition to the weight. And the major medical problems that are going to help you qualify would be diabetes, sleep apnea, high blood pressure, and heart disease.
Okay.
Below that, you won't qualify for
Right.
an operation.
Which, all of what you just said kind of leads to the next question, which is, I'm sure, something everybody asks and a lot of people have concern about, which is there a lot of testing involved to determine if I'm a candidate for bariatric surgery? Because I don't know if you know this, being in the field, most people don't love medical testing.
Well, I can appreciate that. There is, I would say, a moderate amount of testing that is involved. Not a lot of it is invasive, though. So the tests that we require are a couple of x-ray tests, one of which has you go to the radiology center and drink some contrast fluid, and we take pictures as it goes down into your stomach. That's called an upper GI. And it's an important test so that we can see the shape of the stomach, determine if there's any masses or ulcers there, or if you have something called a hiatal hernia, which can contribute to acid reflux. We also get an ultrasound of your abdomen, which is really looking at your liver and your gallbladder to see if you have any liver disease or any gallstones. A lot of people will have some gallstones, and we may be removing their gallbladder at the same time as surgery. We will have you go see a cardiologist to get an evaluation to make sure that your heart is in good shape for surgery. We'll also have you get a sleep study because many of our patients have sleep apnea, and we want to make sure that you get started treatment on that prior to surgery. And then there is some blood work, and we will also have you meet with our dietitians several times so that you can get started working on a diet, and you'll be evaluated by a psychologist to make sure that mentally you are prepared to undergo the dietary changes that we're going to require you to make after surgery. In some cases, if you have a lot of acid reflux problems, we may send you for an endoscopy, and that would involve going to see a GI doctor and getting a scope down into your stomach. You know, again, that is technically invasive, but not a real involved test.
Okay.
And generally that's it, and takes about 3 months or so to get all of that put together.
Okay, so it's a process. So somebody asks the question, I hear there are different types of bariatric surgery. What do you got?
So again, that's a common question. There are 3 main operations that we perform. One of them is the gastric bypass. This is an operation that's been around since the mid-1950s. It involves going in and separating off a portion of your stomach so that the part that gets food when you swallow it down is only about this big. And then the second part of the operation involves rearranging of your intestinal tract so that your body is not going to absorb as many calories from the food that you've eaten. That would probably be the most complex of the operations that we do at Cooper. There's also an operation called a vertical sleeve gastrectomy, or the sleeve, which means that we are going to trim down the size of your stomach by removing a significant portion of it. So if your stomach is about this big, we're going to remove a section of about this much, and we're going to leave you with a stomach that is about the size and shape of a banana. And that is going to limit your food intake, and both of these operations also reduce your appetite because of a reduction in a certain hormone that causes us to feel an appetite. And then finally, there's the laparoscopic adjustable gastric band, or the band. This is the operation that Rex Ryan had, that Chris Christie had, and this involves insertion of a device which is made out of silicone. It's a soft, rubbery type of ring that goes around the upper part of your stomach and gets tightened up over time so that it slowly limits how much food you can eat when you sit down to eat a meal.
So the Rex Ryan mention is great because he has a twin brother, Rob Ryan, who did not get the surgery and has not, let's be honest, taken the greatest care of himself or really strived to lose weight. And
Or
you
gotten
see
a
that,
haircut.
or gotten a haircut. Yeah, he's a mess. But you look at the two of them next to each other, and it's almost like a before and after picture. Now this leads to a question I'm sure is really common for you, which is what happens if I get the surgery, but then post-surgery I don't follow a strict diet?
Okay. The good thing about bariatric surgery is that it doesn't involve you having to go on any kind of exotic or weird diet. Our goal is to get you eating a healthy diet of normal types of foods, because we think in the long run you're going to be able to keep to that better. Now, what happens if you don't follow it? Well, you may regain your weight. In the immediate post-operative period, we're going to be gradually increasing your diet. So at first we just have you on liquids for a couple weeks, and then we're going to put you on pureed types of foods. And by about a month after surgery, that's when you can start having solid food again. If you go too quickly in that period, then you may put yourself at risk for a complication.
Mm-hmm.
Long term, if you are eating things that are high in fat, high in sugars, then the real risk is not that you're going to do any great harm to yourself, but just that you may not lose as much weight, or you may put your weight back on.